Hi, my name is Marina Afikonyo. I'm a medical doctor and an adolescent health ambassador. I work with Nuffield Clinic, Ghana, located at Osu 8 Sunfa Road. So today I'll be answering all your questions about breast cancer. Okay, so the first question is about the different types of breast cancer. And I came along with my little diagram to show you the types of breast cancer. So when you take me, for example, and you cut through my side that way and open my breast, this is it. This is a cross section of a breast. So the yellow is the fat cells in breast. Then we have these structures, the purple, which are the lobules, okay? Then these ones here, we call them the ducts. Now, we have breast cancer originating from just the lobule, and then we have breast cancer originating from just the ducts. And then we have other types of breast cancers that originate from the nipple, and then other types that we may not go into detail. But the basic point is that breast cancer is categorized based on the structure involved. So if it involves the purple, which is the lobule, we call it a lobular cancer. And if it involves the ducts, we call it a ductal cancer. And then we have breast cancer affecting the nipple only, which is called a Paget disease. So we want to know how a normal breast lump feels like. First of all, breasts usually do not contain lumps. Sometimes though, when you're leaning forward and you hold your breast, it may feel like it's a lump. And those things you're feeling are these structures called the lobules. So meanwhile, if you do feel something other than the usual, then we call that a breast lump. How do we know this? Normally, when your breast is lying flat and you're feeling for it, you may not feel anything within the breast. So as soon as you start feeling a structure that is slightly different from the normal breast tissue that you're used to, then we can say that there's a breast lump. Unfortunately, yes. Reason being that sometimes if all the cancer cells are not cleared completely from the body, they may grow again and then recur. And in some people, even when you've cleared everything, just by the mere fact that they've had cancer before, it is likely that they'll get it again. Just that we try as much as possible to treat you in a way that reduces your chances completely. Also, there's a screening tool called the mammogram. Usually, people who are more than 40 years old are supposed to be getting mammograms at least every year. This will help us to know whether there's any changes in their breasts that could cause cancers. There are other ways of checking if you have a breast problem. If you are less than 30 or you're less than 35, you're younger, it is preferred for you to use a tool called ultrasound. First of all, there are some factors that we describe as non-modifiable, meaning no matter what you do, you will get the breast cancer or your risk for getting breast cancer is high. And then there are some factors we call modifiable factors, where those ones, if you do correct them, your chances will be low. What do I mean? So the non-modifiable factors are like age. You cannot prevent yourself from growing. You still have to grow. So breast cancer risk increases with age. So by the mere fact that you're older, your risk of getting breast cancer is higher. And also your genetics. There's something we call genetic material that is located within your body cells. If those genetic materials contain the code that causes breast cancer, you would get it. There are some people who in their family, maybe their mother had breast cancer, the chances that they will also get breast cancer is high. About gender, it is worldwide that women are more prone to having breast cancers than men. So yes, your gender does influence your breast cancer risks. Now there are other factors like smoking, drinking alcohol, obesity. These things all influence breast cancer development. Yes, it is. But you're not supposed to see a very much obvious difference between the two, because normally the left breast tends to be slightly bigger or slightly lower than the right breast. But if you see an obviously big breast than the other one, you should definitely get it checked out. Now the thing is that breast cancer on its own doesn't necessarily change whether you'll be fertile or not. However, the treatment associated with breast cancer could affect your fertility, especially a particular group of drugs we call alkylating agents. So sometimes you may feel a lump in your armpits, which is different from the one in your breast. That is also a sign that you should get your breast checked. Apart from that, if you see a sore on the skin of your breast, that is a sign. If you see that the skin of your breast is looking like an orange peel, where you see tiny dots on the skin, that should give you an indication that it could be a breast cancer. Also, if you see that the skin of the breast is pulling to one side, that's also a sign. If one breast is suddenly becoming too big than the usual, that is also a sign. So if you notice, I keep saying than the usual, that means that you should know how your breast looks and feels like to be able to spot these things. And then if you feel persistent pain in your breast, that is also a sign that you may have breast cancer. Now let's address this myth. Do underwear bras cause breast cancer? There's no evidence to show that these wires can cause cancer. However, they do cause a lot of pain when they are pressing on the breast, but that is not directly linked to breast cancer. And if you still want more information, kindly send us a DM and we'll give you more information. Thank you so much.